contraindications for colonics. Now, there's actually quite a long list of contraindications, and some of these are very obvious, some of them are not so obvious. Some contraindications have directly to do with the colon, like, for example, Crohn's disease or any other acute inflammatory bowel disease like diverticulitis, which is not diverticular, which a lot of people have, but they are not inflamed, in which case you can have a colonic. There's also always the option to have a medicated enema with special anti-inflammatory herbs. Aneurysms within your abdomen or fistulas are definitely contraindicated. Fissures can be contraindicated depending on the state they are in. Same with hemorrhoids. If they are acute and bleeding, you do not want to have a colonic simply because it would be too painful. But if everything is calm and relaxed and your hemorrhoids are good, then yes, you can go ahead with a colonic. An incarcerated abdominal hernia is also contraindicated, especially if it is painful. Really, any pain that you have should be investigated, and then there's a likelihood that the colonics will be contraindicated. Another one would be colorectal cancer, because if there's a tumor present, then we don't want to upset that tumor with a colonic or a massage. If you had a recent abdominal surgery, you can't have a colonic at least for 3 to 6 months, depending on the severity of the operation. Now, a good indicator is if you can give yourself a deep belly massage without feeling any pain, then you probably know that everything has healed, in which case you can have a colonic again. But the minimum time to wait is 3 months after any abdominal surgery. We also have contraindications to do with the heart and kidney. Now, the reason a colonic could be dangerous if you have certain heart or kidney issues is because during a colonic, your body will absorb some of the water we use. So if your doctor told you not to drink too much water, this could be a warning sign for you, and you need to ask your doctor if it is okay for you to have a colonic. Uncontrolled hypertension means when you're not on blood pressure medication. Significant anemia, where you are at the risk of a cardiac compromise or congestive heart failure. If you're on dialysis, unfortunately, you can also not have a colonic because it means that your kidney weakness makes it really challenging to manage water absorption. Other kidney issues like renal insufficiency or a tumor on the kidney would also be contraindicated. So would be uncontrolled diabetes, advanced cirrhosis of the liver, uncontrolled epilepsy and seizures, acute inflammation of the prostate, or severe gallstones. Pregnancy is also contraindicated, but pregnant women can do enemas at home if they want to, and we are always happy to talk to you about how to do this.